This video was created to help you prepare for your MRI scan. Make sure you leave your valuables at home. Leave all jewelry, including earrings and other piercings, at home. Wear loose-fitting, comfortable clothing with no metal or the least amount of metal possible. On the day of the scan, do not use hairspray, hair gel, hair pins, artificial hair pieces, or makeup. To make absolutely sure you have no metal on your clothing, you'll be asked to change into a gown. An MRI machine uses very powerful magnets to create images of your body. Once you have your exam, a radiologist will review your scan and create a report for your physician. Your provider will use this information, along with all of the other information they know about you, to try and understand what may be causing your symptoms. Before you go into the magnet, you'll have a chance to talk to a technologist. A radiologist will greatly benefit by knowing about any other imaging tests that you've had. Make sure you tell your technologist about any other tests that you've had and where they were done. There is some important safety information that you should know before having an MRI scan. First of all, an MRI machine has a very powerful magnet, so it's important that you do not go into the room with any metal that a magnet will attract. Pacemakers are generally not safe. Some newer pacemakers are safe in some magnets, but if your doctor is thinking about sending you for an MRI and you have a pacemaker, make sure you tell your provider and let your technologist know. There are some other important conditions that need special consideration before going in the room with a powerful magnet. This includes having a medication pump, neurostimulator, brain aneurysm clips, artificial heart valves, and cochlear implants. If you have a history of working with metal or have a history of getting metal fragments in your eye, notify your doctor and MRI technologist. You will need to have an X-ray of your eyes to look for any metal pieces that may have lodged in your eye. The magnet could harm your vision if this is the case. Most MRI scans do not need contrast dye to be injected into your veins, but some scans are more accurate with the contrast. The contrast is considered very safe, but if you have an allergy to gadolinium, which is the contrast used for MRI scans, make sure this is known by your provider and technologist. If you have kidney problems or are at risk for kidney problems, you may have an increased risk for complications from the contrast, so make sure that this is known by your provider and technologist. While in the magnet, it's best to close your eyes and visualize that you're in your most relaxing place. You'll be handed a call button to squeeze if you need to come out of the magnet for any reason. It's important that you hold still for the test. Moving will make the images blurry and decrease the chances of finding any problems you may have. Imaging tests are accurate, but they're not perfect. It's important to remember that if your test is negative, but you're still having problems, you'll need to make an appointment to see your doctor, or if you're feeling very ill, seek immediate medical attention. Always follow the instructions that are specifically given to you by your healthcare provider. If you have any special questions about your MRI exam, make sure you write down your questions and bring them with you to your appointment.